I am Liz Powell. I'm one of the co-founders of the Women's Digital Health Network. I'm also founder of G2G Consulting. So I do lobbying and advocacy work in Washington, D.C. I am joined by my two co-founders, Netta Hanafi and Bethany Corbin, and three amazing speakers who are going to enlighten all of us on the amazing capabilities of imaging technologies and how they really are revolutionizing women's health and advancing the health of women. Before we get to that, I just wanted to quickly spend a little time on what is the Women's Digital Health Network in case you are not a member yet. We invite you to join. Our website is womensdigitalhealthnetwork.com. We are an organization of folks who are very passionate about that intersection of women's health and digital health. And we are working together to educate decision makers in Washington on how regulations and policies are impacting the health of women and what they can do to make them better. We have a lot of industry leaders in our organization. We have individuals. So if you care about women's health and digital health, please join the Women's Digital Health Network. And without further ado, I would love to pass it to my co-founder, Netta Hanafi.
Thank you, Liz. Good morning, good evening, good afternoon, wherever you're calling in from. Thank you for being here and taking time to join us today. As Liz said, I'm Neda Hanafi. I'm one of the co-founders of the Women's Digital Health Network. And in my day job, I'm also the co-founder of MedTech Strategy Advisors, which is a small firm with me and my co-founder Kelly, where we work with companies in the medtech space to help them navigate their evidence generation approach and get their products to market in a least burdensome manner. We like to think of bridging that health equity gap, working with founders of color, female founders, and founders focusing on innovations in hard to innovate spaces such as women's health and pediatrics. So, without further ado, as I open up, I'd love to invite our panelists on stage. And today is October 31st. It's the last day of Breast Cancer Awareness Month, October. And this year's theme is No One Should Face Breast Cancer Alone. And it highlights the importance of patient-centered care, which includes medical, emotional, psychological, and social support throughout the patient navigating healthcare systems, while also addressing gender and socioeconomic disparities in access to breast cancer care. So collectively, we are stronger together. I'll just start with some very basic facts and statistics according to the National Breast Cancer Foundation. So 1 in 8 women in the United States will be diagnosed with breast cancer in her lifetime, not an insignificant number. And it's estimated that 310,720 women and 2,800 men will be diagnosed with invasive breast cancer in 2024 alone. And it's chances that we all know at least one person who has been personally affected by breast cancer. But there is hope. And especially when it's caught in its earliest localized stages, the 5-year relative survival rate is 99%. So with advances in early detection and treatment methods, we have a significantly increased chance of surviving breast cancer. And currently, there are over 4 million breast cancer survivors in the United States. So we all need to be aware and we need to be proactive in our care. And that's part of the discussion here, the realization of technology to really improve outcomes for women across the lifespan. So on stage with me today are 3 of those leaders within some major, very well recognized global imaging technology companies working in this fight and this effort. And we're coming together, leading by example as how we can collaborate across the medtech ecosystem. So thank you all online for joining us. And I want to thank the 3 of you for taking time and sharing space and your expertise and energy. With that, I'd like you to introduce yourself, who you are, where you're dialing in from, why you're choosing to spend your precious time with us today, and a little bit more about your respective company and what you do, your focus on breast imaging as a whole, and and other imaging modalities for women's health. And then just as a little tad bit, what is your superpower, or what Halloween costume are you wearing today, or plan to wear, or would like to wear, or of that of someone that you love is wearing as well. So how about if I start with Amanda?
Thank you, Netta, and thanks to you and Liz for the invitation to join the group here today. As you mentioned, my name is Amanda Depalma. I have spent all of my career in medtech on the product development, marketing, and sales side. I'm currently the head of global marketing for the ultrasound division within Siemens Healthineers. All right, I'm going to try to remember all of your questions. Siemens Healthineers, along with my counterparts here, is one of the world's largest imaging companies. And you can see our purpose is to pioneer breakthroughs in healthcare for everyone, everywhere, sustainably. As it relates to our cancer care pathway, we have solutions that really try to help the patient through the journey. So whether it's screening, just early screening, like, we were talking earlier, we all do every year, or we should be doing every year, whether it's yourself or through imaging, having that screening. We also have imaging solutions for diagnostics. We've got our Varian company for the therapeutics, should it be needed. And then we have the imaging technology for follow-up and survivorship. I think let's see, next question was like superpower or costume.
Your superpower or your costume?
I think, well, I have teenage boys, so there's not really very interesting costumes happening in my house this year, just trying to keep everybody safe and making smart choices. I think my superpower, and I know we all know I don't love talking about myself, but I think it's connecting, right? I think the fact, Netta, that I know you've introduced me to this group, to Liz, and the fact that we are all coming together. And for the audience, we all compete, right? We're all major competitors, but I also think as human beings, we are women who care about what we do. And there are unfortunately way too many patients that are going to need our support. So I think just coming together and for the greater good of what we can do and connecting and having real authentic conversations is what's important to me. And that's why I chose to be here with you all today.
Awesome. Thank you, Amanda. And where are you dialing in from?
Oh, sorry. I am outside of Seattle, Washington.
Wonderful. Well, thank you. It's such a pleasure to have you. All right. I'm going to flip to Jyoti.
Hi, everyone. Jyoti Gupta from GE Healthcare. Thank you, Liz and Nada, for the invitation to be here. Really excited to be speaking to all of you. So perhaps a little bit about me from GE Healthcare. Our purpose is create a world where healthcare has no limits. We are very similar to Siemens, a large, global medtech company. We play in many different spaces, starting with, we have imaging. So you can think of your sort of CTs, X-rays, MRIs, PET scans, mammography, obviously, and then also ultrasound, which is used for imaging in the reproductive space, OB/GYN space, cardiac care, in general imaging. Also, we work in the monitoring space as well, and so that includes monitoring in the acute care, intensive care, even monitoring at home, maternal and infant care monitoring as well. And then lastly, we also play in the pharmaceutical diagnostic space. So this is really radiopharmaceuticals, contrast agents that can be used sort of help you see when you're using your imaging devices, but also more and more those are being used for therapeutics as well. And we work across all care pathways. So areas that we look at are neurology, Alzheimer's being a big focus, oncology, so breast, lung, prostate, all being a big focus. And then also cardiology, right? That's another area of focus for us as well. For me specifically at GE Healthcare, I run our women's health and X-ray business. So I have mammography, very much focused on bone density as well. So women, as we're entering perimenopause, menopause, we cannot forget about osteoporosis and your bone density. And then also I have X-ray. I've been in medtech my entire career in different spaces. So in spinal implants, in ophthalmology, in drug delivery, and now in imaging. A little bit, I think, about you asked superpower. So mine I would say is really connecting the dots. I've had the good fortune of living across the world. This is my fifth country. But I've also worked at, different companies in the industry, both small all the way from startups to, large as GE Healthcare. And so really just the ability to sort of look at things from a zoomed out perspective, systemically, and, connect the dots. If you sort of move one lever here, what happens there? I'd say that's probably sort of my business superpower. If you ask me what's my fun superpower, I'd like to think it's I can understand dogs, or at least I'm trying to. So that's probably on the fun side. I'm not dressing up for Halloween this year only because it's Diwali. So happy Diwali to those of you who are celebrating. So I'll be spending my evening doing some fun family stuff. And I'm dialing in from the Maryland area. So really nice to be on here. Thank you.
Wonderful. Thank you, Jyoti, and thank you for reminding us it's Diwali. So awesome. I love this connection. All right, by no far the least, but the last, Mia Keys.
Thank you, Nada, and thank you, Liz and Bethany, so much for having Amanda, Jyoti, and I. I feel very, for lack of a better phrase, giddy about this conversation, because I think we feel, irrespective of where we are as industry leaders or where we are politically, I think we all very much feel just a palpable energy in the air. The fact that there is now there is a tumultuous crisis with respect to women's health, but there is this fervent conversation on research, on appropriations, in an historic way with respect to the health of women across the globe, with especially a lens on what's happening here in the U.S. And I'm sitting in D.C., and I love the fact that each of us is coming from this angle, literally from different geographies, from different past lives, different ethnicities and nationalities, and just on and on in terms of the intersections of our identities. I couldn't be more glad and proud to be part of this conversation. So thank you. So I'm with Hologic. It's a women's health and innovation company that's based in the US and it's global facing. And I serve as its director of global health and innovation, which is a newer capacity for me. I've been with the company for 2 years, and prior to coming into this position, which really draws on my skills as a researcher, as a writer, as a collaborator, and person who's very much invested in partnerships building, and also using data to tell stories. Prior to this, I served as its director of federal affairs, so I was very much facing in terms of members of Congress, their staff, executive branch, and so forth. And so Hologic stands very much for what both Amanda and Jyoti have mentioned. So we primarily work at intersections of women's health as it's expressed in a more traditional sense in terms of health that is specific to women, but then also health that uniquely and disparately and inequitably oftentimes impacts women. And we do that through our devices in the breast health space and gynecological health, sexual health, with respect to skeletal health and body composition and so forth. And so as today is the last day of Breast Cancer Awareness Month, it certainly behooves me to focus my conversation on our work in that space. So Hologic is the creator of 3D mammography, and it's fascinating to me as someone, and I know I'm not unique in this sense, someone who has lost family members to breast cancer. I have very close friends, all of us under the age of 40. Some of us have had bouts of cancer. My one very good girlfriend just overcame stage 3 cancer in April, and through June after a double mastectomy, and she's a mother of 2, doesn't have a history of cancer in her family or in her life. And had it not been for her own self-persistence and advocacy, she wouldn't have even qualified to have the mammogram to begin with. I'm really proud that she was able to move forward and make sure that she was taken care of, because this year, had she not done that, I'd be showing up to you in a different space, likely, than if she didn't advocate for herself. And she also benefited from a Hologic device. I'm so grateful for that. In terms of the ways in which I show up in this work now, I primarily work with members, with our partners across the world. and really help them to use some tools that Hologic puts forth to help to tell the story of women's health in their country or state as in within their country or on their continent, and really also to help dispel various myths or to break up misinformation, disinformation with respect to women's health. And we do that through something called the Global Women's Health Index, which I can tell a bit more in perhaps as we continue the conversation. But the short of it is, it's a Gallup-based poll that works that essentially asks women, about 97% of the population, women and men across the world, about the state of women's health. And what we know, especially when it comes to breast screening, is that screenings are down. We almost don't even need data to tell us that, but because we ought to be metrics driven, data driven, the data matter to tell the prime story. Screening is down in a really very dramatic way with respect to breast health. And there are women across the world, even in high socioeconomic status points, that don't know what a mammography is, or a mammogram is rather. And so it's my job and my duty to really help to close those gaps through, again, the advent of stories via data, and certainly through meaningful partnerships. And again, thank you so much for being here and having me here. My superpower. So I would say, similar to what Amanda and Jyoti shared, I would say that my superpower is twofold. It would be one, deep listening. I think there's nothing that can get done in a very sustainable way or in an agreeable way unless we're able and willing and have the practice of listening to one another in a respectful, valuable way. And then also, I think I lean into discomfort very well. Jyoti and I, we share this. I've lived across various continents and countries, and I've been able to pursue myself in fearsome moments and moments where my comfort was certainly not foremost. And I learned a lot from myself. I learned a lot from people around me who were teachers and they didn't even know it. And I expect the rest of that for the rest of my life.
Wow. Okay. Fearless discomfort, lean into discomfort. I love that, man. The power of connection, the power of we. I always say collaboration can save lives, and you're living examples of it. So thank you for sharing, all of you. You all talked about awareness, and it starts there, right? And I'd like to maybe just go around and learn a little bit more about how your respective companies are working in that space. And then maybe we can move into the policy and then the access aspect. So, Jyoti, would you like to go first? Maybe how you guys are raising awareness, because you said the numbers are down re-screenings.
Yeah, happy to. So, we do a lot of work, I would say, in awareness, both sort of at the government level, but also directly to the woman, right? At the government level, really, with our government affairs, spending a lot of time meeting with, our congressmen and women across, every state to help them understand the unmet need in breast cancer, the challenges associated with breast density, the need for additional screening, the need for covering, right, to preventing out-of-pocket costs, right? So education and awareness, for these Congress members is something that our team spend a lot of time on. I personally as well, myself, join them quite often. We also spend days, going to the Hill and meeting with different stakeholders and having those conversations. But, we've also been in conversations where, as for those congressmen and women who are very interested and are motivated to drive change, to drive reform, we have conversations where specifically they're requesting us for certain data, right? We've been in meetings where they'll say, I can help you drive change. I need your help to get A, B, and C, whatever that may be. And so then our teams work together to help put that information together, really to equip them with the right information to go drive change. When it comes to women directly, right, it's really around awareness on the risk, right? It's really, really important for women to know what their risk is. And depending on your risk, that's going to dictate, what sort of your pathway is. And so we provide a lot of information, materials, videos, webinars, seminars associated with that. And then also talk a lot about what are the different options that are available directly to women. In different parts of the world, we are a global company. We touch over 1 billion patients every year across the world. We'll also have buses, with mammography systems that will drive around. Depending on the country and what's allowed, we'll conduct mammograms in remote areas, in rural areas, or at least even if we don't do the mammogram, we'll go around talking and raising awareness. So there's work on the ground and boots on the ground, direct, and then there's also work all the way up to the government, and then everywhere in between.
That's awesome. I mean, Amanda, do you have any other specific tactics? And what I really love, Jyoti, is the hands-on, like the practical piece of empowering or arming Congress with data, and then the outreach directly into communities. But I'm wondering if Siemens Healthineers, I can't get my words right today, have a different or can add on there as well.
Yeah, I'll say I think all of us being large companies have very similar efforts. I think that's what you're alluding to. And we certainly are on the Hill having conversations and trying to provide information to advocate for access. But something more maybe tactical that we have done at Siemens Healthineers is with the new dense breast legislation that went into effect like 6 or 8 weeks ago. 39 states already had this requirement in place that if a woman has a mammogram and she's found to have dense breasts, she needs to be notified. But we took that as an opportunity, since it's now a federal requirement, to give our customers information that they can provide to patients to help them understand what dense breast means, what are the risks, and what are the next steps that they should be seeking to get the additional screening that they deserve, to understand if they have, if they're in any phase of breast cancer. I think what is frustrating, right? And I showed you this earlier, but I brought my letter, right? I went and had my mammogram like 6 weeks ago, and I got the letter. And I think it's interesting when you're on the industry side of this and then to be a patient. So I have resources, right? I have the ability to go and to push for additional screening, but it's not paid for right now. So how do we help women understand what it means to have dense breasts and how they can navigate the system to be able to have access to the additional screening that they deserve to understand if they have breast cancer? We are working on the Hill with the Find It Early Act, which is really trying to advocate for payment for that additional screening. The reality is it probably won't go through this year, but there's effort and energy around it. And I think if we all come together with AdvaMed, industry, and our government representatives, that we together, the collective power of these companies, should be able to create the access and the understanding for women who are at risk of breast cancer. I mean, I have all this stuff on my desk, right? Like in Washington, 51% of American Indian and Alaska Native women 40 years and older had a mammogram. 50%. That is not enough. And mammogram wait times and increased reimbursements, we're waiting for improvements in those areas. So I think together we need to help the physicians who are super busy, right? They are all understaffed. They don't have time to have the kinds of conversations they want to have with their patients. So how do we give them information to share and be a resource? And then how do we work together with our government to make sure that women have the access to the care that they deserve?
Thank you, Amanda. And I think, clearly we have a very active group online here asking some really good questions. And it's going back to this awareness and what you mentioned, Mia, about screening rates going down. And we want to kind of dig a bit deeper there. And is there a reason? Do we know why it's going down? And how do we change that trajectory? Again, what are some of the efforts companies are doing? So if you could speak to that.
Sure. So, let me preface this by saying these are global metrics, right? But the US is certainly a telltale sign with respect to the direction of women's health. Screenings are the rate of screenings are decreasing for a number of reasons. One, or had decreased over the last few years is the better way to put it. One, we're coming out of COVID. And with respect to the denouncement or prior to the denouncement of the public health emergency, we certainly saw just a stalling of women in particular being able to access their care providers, right? And I don't have to go on for however long it'll take, because it will take a very long time to talk about all the things that women bear outside of caring for themselves, especially if they're mothers and their daughters who are carrying up and down the generation continuum, right? But when it comes to putting ourselves first, we all know what anecdotally what we experience and what the data tell us. But so COVID-19 certainly had a major impact on that. The other thing is the impact of USPSTF is also something to be mindful of. The United States Preventive Services Task Force and the screening guidelines. There's often a lot of confusion around what it means to be able to access screening, or who should be recommended for screenings. We've seen over the years the ages shift in terms of who should be presenting for breast health services, primarily for cancer-related screenings. We saw it go from 50 to down to 40 something, down to 40, but you really ought to get it at certain ages. It's confusing for the American public. But the main takeaway ought to be, and this gets at the prior question about awareness building, is who are the messengers, right? Who are the messengers to create spaces for women to ask their pertinent questions, right? Before they even get to a provider, where are they getting their information? And I think to your point, your last question, or the second part of that question, that what can industry be doing better? And Hologic included in this is working with trustworthy partners. Those partners, those entities that are trustworthy. And by that, I mean, not everyone trusts the government, the word of the government, especially coming out of 2016 and on through. There's been major shifts in terms of where people feel the government powers are able to elevate the questions and the subjects that matter the most to them, especially when it comes to women's health, and not just the government in terms of the main policy branches, congressional, but also judicial systems, and the way that women's health narrative is told in the world. And even just colloquially, the ideas of, I don't want to be, very, I hope this doesn't come across as very highfalutin, but the idea of patriarchy and the ways in which conversations from a patriarchal view impact and influence the ways in which women's health is discussed, and so there's a lot of fear mongering around presenting for services and where can I go? Can I go to this place? But if I go to this place, am I going to be looked at a certain way? So there are just a number of political as well as just overall lack of awareness and fear that implicates the ways in which women move towards screenings or towards self-care. One thing that we saw in Global Women's Health Index is beyond, presenting for traditional care, just women's needs in general are not being met across the world, right? So we know with respect to social determinants of health, structural determinants of health, digital determinants of health, women aren't able to often afford housing or they don't feel safe in places where they live. And if they're not living in spaces that are safe, they're likely not living in spaces where they can access very quickly or without any sort of barring the actual care that they need. And that matters in terms of the advanced cancer rates that we're seeing, especially amongst women who are Black and brown. You see cancer rates just completely blowing up out of the, with respect to Black women, it's over 40% of Black women, or not over 40%. The rates at which Black women are dying are 40% higher, almost 40 or a little bit more than 40% higher than they are compared to white women with respect to breast cancer. And that doesn't have to be the case. It has nothing to do with their Blackness. It has everything to do with all of these other elements that we've discussed. And I'm sure we'll likely get into that a bit more.
Yeah, no, I mean, we know the health inequities stem from the lack of trust and the historical racism in how healthcare is practiced in this country.
But I would even switch that language, Nada, because it is, I know what you mean when you say lack of trust, and most people know what you mean, but it really has to do with lack of trustworthiness of institutions and the ways in which even industry leaders we've got to do a better job, a more deliberate job of displaying ourselves as trustworthy entities so that patients can see themselves in the care, in the devices or whatever, in the clinical trials. And over time, over tedium, show up in spaces where women already occupy those spaces. And then that's when I think we will see a return to levels pre-COVID and more.
Addressing these inequities. You raise such an amazing point, and that's why you have the diversity in this panel, right? If we can't have leaders that represent the patients and the communities we're developing these innovations for, we're not going to develop the right innovations that work for those unique needs. Amanda, I see you leaning in, and I know you have comments because I'm sure I'm enjoying to what Mia said.
Well, I was just listening and thinking, I mean, I think from a technology standpoint, we're all making tremendous progress, and there's more work to do, but I don't think that technology is the issue. I think it's all of these areas that Mia was speaking to. And honestly, what was going through my mind is how do we work together to build the trust back and the trustworthiness back, right? We can say it. But for someone like myself, how do I and my teams understand what it means to actually build that trustworthiness back to ensure that we are authentically reaching these women and patients to give them the trust, the security that they need to come forward and take care of themselves?
I think even just asking that question is the mark of a great leader. And as a, I know you're representing Siemens, but you're also coming at this work with everything that you embody in the way in which you live your life, Amanda. And so one thing that I would say, this is a virtual table that we're all sitting at. It would be working with those organizations in specific communities. I mean, like actual towns or actual academic spaces or academic health centers, and saying, we want to learn from you. And, so some things I think, and Hologic is getting better at this too. We are partners to a number of entities. But what does partnership look like? Partnership doesn't have to just be giving money, right? And it really shouldn't just be giving money. It really should be, well, let's sit at the table and talk about ways that we, industry, can show up in a better space to enhance the work that you are already doing on the grounds, partner, or to sit at the table and learn what the gaps are in awareness and understanding amongst the patient base, aka, at least in the technology space, the user market, and talking about it from a language that appeals to industry leaders, but also being very clear that the discussion we're having is imperative. It's imperative to the business, it's imperative from a health equity standpoint to the advance of healthcare. But yes, the short answer is identify ways that we can be partners beyond just giving money.
Yeah. Love that. Jyoti?
I would just add, look, I think, me and Amanda summarized really, really well. I think, as you go outside, the only comment I'd add is sort of as you go outside the US, this gets exacerbated even more. There's just so much disparity. There are countries where screening rates are, sub 10%, right? And there's a lot of, to the point about fear and trust, once I do know, do I want to know? Because once I do know, what happens, right? What happens to my life? Who's going to take care of me? How do I afford the treatment? And so, there's fear of the unknown as well, and fear of not knowing what solutions exist and how is the system going to support you. So I agree with everything they said, and I think there's opportunity both here, but I think it's our job to also not forget the rest of the world as well, where it's even more acute.
Yeah, and it's a great point. And we had a big internal kickoff meeting a few weeks ago and had a woman, a breast cancer survivor from Nigeria, come in and speak to the team. And to your point, when she was diagnosed with cancer, her husband left her. Her kids were afraid of her because they didn't understand what cancer is, how you get cancer, and they were afraid that they were going to catch cancer from her. So she is now, been a survivor of 15 years, had cancer a second time, but has dedicated her life to advocating for patients and awareness to help people just understand the truth and not the misconceptions, because then people don't want to get screened because they're afraid of what they're going to find out and what that's going to mean. The reality is we need everyone to get screened and make sure that they have choices as early as possible to return to health.
It really highlights the cultural context, right? And words matter, and how you deliver information, and meeting patients where they are. I mean, you've spoken to all of those aspects. Oh, there's a lot of questions in the chat. And by the way, everyone, Liz is active in the background. She's putting in all these resources, these links to all the things everyone's dropping, all the knowledge that's being dropped. Liz is giving you the actual direct links there. We have a question, and the question I asked before about why the rates are going down was from Ingrid. So thank you, Ingrid, for that. But there's a question from Malcolm, and he is saying, his question asks, FDA implemented a rule requiring mammography facilities to notify women about their breast density. And breast density is a huge topic and aspect. And I think there's this myth that it disproportionately impacts Black and brown women or women of color. But there are a lot of Caucasian women who have dense breasts as well. So he's asking about do we see the existing solutions solving this problem? And what does it mean for innovation in this area? So maybe we can just double tap into the dense breast aspect and have you all speak to your thinking there. Whoever would like to go first.
Perhaps start here. Maybe, I'm not sure if everyone on the call sort of understands why we're talking so much about density and why it's important. So perhaps a little bit of just intro on that, and then we can dig into the question. So, your breast is made up of fibrous tissue, glandular tissue, and then fatty tissue. And in breasts where you have more fibrous and glandular tissue than fatty tissue, those end up being dense. And so if your breast is fatty, your mammogram is going to look, quite dark, more black. If your breast is dense, it's going to sort of have, more white on it. When you're looking at the cancer is typically some shade of white or some shade of gray. And so that white over white, as the density increases, it masks the cancer, right? And so that's really why breast density is so important. It's so important for you to know your breast density, because there are options for you. The other thing I'll just say on breast density is, if you have dense breasts, you have a higher risk. You are 3 to 4 times more likely to get breast cancer. And so of all the breast cancer that exists, 70% of it tends to happen in women with dense breasts, right? So again, more reason for why you need to know what your density is. They're different. I mean, mammogram is sort of the standard, right? But we all know that mammograms are not the most effective for women with dense breasts. And so there's ultrasound, right? That's one that's commonly used to supplement. And it's good, but it's not really, ultrasound doesn't help too much in what we call calcifications. It's really good for masses and lesions. And then you have MRI, which, right, the ACR is recommending MRI, and that's great, and it certainly has higher sensitivity and specificity, but access becomes an issue. It's very, very expensive. It's not everywhere. A lot of centers, especially as you get in rural areas, do not have an MRI available, or if they are being used for other things or for higher value, higher reimbursement related things, right? So then there's contrast enhanced mammography, which is something, all of our companies are working on. That sort of opens up the access. It's done on a mammo machine. It opens up access. It is more affordable. But there's much more work to be done, on the reimbursement side. So coming back though to the question, I think it's, do you see existing solutions and what does it mean for innovation? So there's always room for innovation, but I think even with the solutions that exist, I think the adoption, the implementation, the reimbursement, right, with what we have today, there is so much more that can be done. We actually have a lot of the solutions that, if deployed and if just access is given, if insurance covers it, which is why the Find It Early Act is so important, right? That itself will improve the rate of finding breast cancer, right? And then beyond that, though, certainly, right, there's always room for more innovation as well. I think more functional imaging, more spectral imaging, right? There's opportunity always, and I think all of our companies continue to advance how we think about imaging and breast cancer detection.
Awesome. Thank you.
I know Amanda has something to say. I'm very curious what you've got to say, Amanda.
Oh, thanks. I was just going to say, along the lines of that questions and similar to what Jyoti said, I think that there's a lot of technology out there, and we can find, we have the technology to find even the smallest lesions these days. But it's confusing. I mean, I showed this earlier, but I brought it because I try to understand, what are these patients that we're talking about really going through every day? And this is, my letter to notify me that I have dense breast. But what does it really tell me? It tells me that dense tissue makes it harder to find breast cancer on a mammogram and also raises the risk of developing breast cancer. Your breast tissue is dense. In some people with dense tissue, the other imaging tests, in addition to a mammogram, may help find answers. What does that tell me? I mean, thankfully, I am in imaging and I understand that. But if this was one of my sisters, one of my friends, someone that is doesn't have access to healthcare, it probably took them 2 years to get in to get that mammogram. Now, what do you do? Who do you go to? Who do you call? So you go back on hold to get another appointment. Insurance denies it because it's not reimbursed right now, and you get tired. And that's if you have the resources. If you don't have the resources, how do you even know what to do with this letter? I mean, honestly, it should just be as easy as you have dense breasts. We're calling to schedule your next screening, which is going to be an ultrasound or an MRI. Come on in. Because if you don't advocate for yourself, and women have different reasons why they can't or won't or don't, positions of power within within medicine, and trust your doctor. And, you kind of have to be a pain in the butt to advocate for yourself and keep pushing through all the no's or all the questions or just do this one more thing. And I think that's the biggest problem. I mean, my friends who are breast cancer survivors are survivors because they were a pain in the ass. Because when the doctor told them they couldn't see them for 2 more months to answer their questions, they went and stood at the front desk and said, I need to see someone right now. Not everybody is going to be comfortable or have the ability to do that. And you shouldn't have to. You shouldn't have to do that to fight for your right to live and be healthy, especially in a country, like the US, where we spend so much on healthcare. It should just be available, let alone the rest of the world, where everybody deserves the right to these technologies.
I love that. Health is a human right.
No, can I also add,
Yes,
because
please.
both Joycey and Amanda, the way you both put it couldn't have been more plain. Even if I weren't in the field that I'm in, because I know that there are listeners who are part of this webinar who themselves have received that letter. But the law of the land is not that additional follow-up. It's literally just that you have to be notified, right? There's no additional more upstream coordination that is displayed, unless you're spot on there. You're advocating for yourself, which requires time, it requires energy, it requires money, it requires days off, it requires childcare, especially if you're trying to do this work, if you're a mother and you've got young children at home. And so, I know there's a comment in the chat that has to do with industry thinking about prevention, right? These upstream issues, right? And I think that is another area, to get back to Amanda's initial or earlier question of how can industry be better partners, even just to the women and patients who are in beneficiaries of the devices. And it is being mindful that for the most part, we show up at the innovation stage, and we can do better through partnership. We do need to partner with other people who are a lot more concerned for the long haul with what are those prevention spaces, right? And that's just real fact. It's not necessarily always something that's discussed in a way that everyone understands. The other thing too, with respect to dense breasts, and I know we're not going to linger here too much longer, but for women who are breastfeeding, and there's this, you go deeper and deeper into these sub levels, or at least these various identities of across the woman's life course. When she becomes a mother, she chooses to breastfeed. Having access to a mammogram, it varies. If you're breastfeeding. I was breastfeeding. I had been breastfeeding when I got my mammogram, and I was under 40. I am under 40, but I was under 40 at the time. The only reason I was able to get it is because I have a history in my family, and I had to push my insurance company to pay for it, right? But I disclosed, I said, I am breastfeeding. I had been doing so for like 11 months at that point. And lo and behold, I still got the dense breast. I knew I had dense breast, but I knew I got the letter. And similar to what Amanda mentioned, it didn't mention anything in terms of follow-up. It just said, you've got it, that's that. But so the last thing I would just say is in terms of industry partners, in terms of wherever you sit in the spectrum of healthcare, and it doesn't have to be traditional healthcare, go deeper, ask why. And by the way, and we haven't talked about this, this isn't really the forum for it, but women who historically have dense breasts, they come from areas in the world where biologically speaking, that tends to be the case, right? There's a relationship between dense breasts and other biological functions. That does not mean, again, that Black women, that women from Mediterranean areas are themselves doing something to themselves to make their breasts more dense, or doing something to themselves to make them more susceptible to breast cancer. It has everything to do with, there is a biological component that's not race driven. It's not race driven. It has everything to do with the ways in which our body reacts to our environment, which is a whole nother level of science, social science, which I'd love to talk about another time.
I love that. Thank you. And I thank you for addressing the prevention piece. It's not just about the screening, but what efforts can companies do to ensure there's better awareness? And then on the prevention aspect of probably engaging with community-based organizations, with either faith-based organizations, and kind of meeting patients where they are and entering communities in a manner that's respectful to build that trust and communication and heightened awareness and education. And it seems like there are efforts within these respective companies in terms of doing that appropriately. So maybe we can touch on AI, because AI is hot and someone already anticipated the question. So we talked about a lot of, potential problems or issues, and we can always do better. What is your vision, or what is your company specifically doing in terms of the use of AI to address some of these problems? And maybe even with lack of access, but either improve screening, etc., or even addressing the lack of screening rates. Who'd like to go first? Jyoti?
Yeah, perhaps I can start. So AI certainly, I think, is going to transform healthcare. I think one of the biggest applications for AI certainly is healthcare, right? About more than 95% of the data that's generated in hospitals just goes into some black hole and is never looked at, and it is just so rich, right? And I think if we start understanding that data and leveraging AI, I think we can uncover and solve many problems. But specifically within sort of breast and imaging, the way we're looking at it is a few-fold. One, I think you alluded to earlier, I think Amanda did perhaps, there is a shortage of specialists available, right? There is a radiologist shortage, there is technologist shortage, and this is a global issue. In the US, there's been a study that greater than 80% of hospital systems have a lack of specialists. And so one is, how do you drive operational efficiency within a healthcare system? And so today, our physicians are overloaded and burdened with just so much administrative work, right? The administrative cost is very, very high. And so leveraging AI to really reduce the administrative burden so they can actually focus on, risk-based efforts versus volume-based efforts. I would say sort of that's one, reducing the number of clicks that they have to go through. So operational efficiency is really one that then frees up, right, your specialist to focus on patients versus on the machine. The second I would say is, when you're doing the imaging, sort of, now you move sort of the scanning, there's a lot of opportunity there just to use AI to improve and enhance the image quality, to sort of improve that signal to noise ratio. And so you get a better image, which then allows you to see cancer, detect cancer better, but also potentially speed up, right? How you do the processing can speed up how quickly you can do the exam. And, we have a product in our MR business called Air Recon DL, and that's cut the time to get a scan, from 45 minutes to, sometimes 15 minutes. And so that creates throughput. Right now, more patients have access to that machine. You get more people through. And then, the other area is really in the clinical decision supporting. Cancers do get missed. Radiologists are human. They are sitting all day, every day, right? I've had people tell me, if you want your image read, go in the morning because they'll be more alert, right? I mean, they are human, and as the day goes on and you sit in a dark room and you look at images all day, it is, and then if you have dense breasts, it just makes it much harder. And so using AI to augment the radiologist in clinical decision support, right? To say, hey, you might have missed this. That's another area. But if you can take that further, if you go outside the US in some parts of the world where there's really an acute shortage, we're already seeing countries and hospitals implement sort of AI as the first pass, because the alternative is your image won't get read. And so they're using sort of AI first in some parts of the world that I've seen in sort of pilot scale. So those are sort of a few areas, a few ways that we as a company are looking at it. But there's just so much more you can do, I think, even beyond that, when you start going sort of across, beyond your mammogram, as you start looking across your images and you look at, data over time and start connecting those dots. There's just a lot of value to be extracted. So we're just at the start of this, I think, long way to go. And I'm sure, my colleagues here will be talking about similar things as well.
Yeah, there's a lot of use case examples, triaging, raising awareness. Here's a hotspot, and how, I mean, I think FDA is putting a lot of focus on this, and they have a digital health center of excellence that really talks about how to develop a model, how to train it, and then how to execute it, and making sure that your training inputs are on patient populations that are representative of the disease state you're going into. So that's really a critical space. Amanda, I saw you unmuted, so please jump in.
Yeah, I was just going to add, I mean, same thing. We're all in very similar spaces and companies that are looking at things, I think, in similar yet different ways. And I agree, there's so much that AI is going to help us with, looking at patient records, pulling out trends, pulling out identifiers that could, lead to just higher risk of certain diseases. I think in the ultrasound space, what we're doing with AI, when you look at the scanners, so in the US, sonographers, but outside of the US, doctors who are doing the scanning, major shortage in scanners, lots of injury from the repetitive motion, and lots of inconsistencies because it is still very much a human-driven kind of imaging modality. And so our AI algorithms in the short term are very much focused on workflow to reduce the amount of movement and touches that a sonographer or a scanner has to do all day long, right? They're holding a probe, they're in weird positions, trying to get that best image. So how do we make that easier for them to get an image more quickly, more consistently? We also have some algorithms around reducing the false negatives, so we're getting the right patients through to the next round of screening. Something outside of my company that I thought was really interesting. I joined locally in Seattle, the Black Angel Network last year, I think. And ironically, it was industry agnostic, but ironically, there was a small ultrasound company that was looking at robotics with an AI algorithm to allow a sonographer in a remote area to manage a robot in a rural setting to do initial screening. Now, this is for echo, not for breast cancer, but or breast screening. But imagine, once you get this technology, I think just allowing access to care and meeting the patient where they are is something that's hugely important. And I'm sure many of us are working on different types of those. But I think what I love is that, innovators, small companies, big companies, we're all seeing the problems and trying to solve it. And so collectively, how do we make sure that the innovation, and that company in particular was really more than studying the robot, studying the patient flow and the patients in those remote areas. What do they need? And I think it's those combinations, right, that hopefully will help us move these conversations forward into tangible actions that patients are, benefiting from. So I think there's a lot of good stuff going on.
Absolutely. I hear that a lot as we're trying to democratize healthcare and accessing all those healthcare deserts across the spectrum. Mia, you unmuted. So please jump in.
Yeah, I really appreciate what both of you have offered there. It's very clear that you're right, both of you, we have all the innovation at our disposal. And frankly, our imagination and the innovation is moving faster than those more upstream issues that Jyoti mentioned earlier, which is the innovation is not necessarily going to always be reimbursed, not at the rate at which innovations are moving, right? And so the ways in which not even just industry, but really the public ought to show up and can show up in this conversation is how do we, as actors in 21st century American life, and specifically from a healthcare perspective, how can we help to galvanize the imagination of decision makers who are the ones who are going to be in charge of whether or not populations at the intersection of race and gender and geography and language can benefit from the rapid pace and development of innovation. And same with providers. I mean, if innovations are not consistently reimbursed, providers have no incentive to use those innovations, right? And especially if you're talking by reimbursement, I'm really specifically talking about like Medicare and Medicaid, right? CMS was designed in the 1960s, right? And Medicare and Medicaid was born during the civil rights period when the dominant imagination at the time was just making sure that the invalid, so-called, and those who had been historically underserved medically had access to care to begin with, right? We're still having a similar conversation today, just with a layer of innovation. And I, for one, am very excited about healthcare innovation and specifically the ways in which artificial intelligence and assistive intelligence and autonomous intelligence can show up in our lives. But if Congress, which has a huge learning curve to learn about AI, hasn't yet caught up, if CMS in all of its rigor and their academicians over there, they're very heady. They want to make sure that they're doing what they can. They're physicians. They want to make sure that that they're doing no harm. But again, they don't have the staff consistently to review all of what FDA has approved in the same timeline that approvals come through. So things sit in the pipeline. So what does that mean ultimately for the ways in which patients can benefit from AI? It means we are going to see stagnation, and where we're really going to see stagnation are for those patient populations that are dependent on providers who service from a Medicare and Medicaid reimbursement standpoint. But they may or may not be using the highest technologies if it's not being paid for. So these are more upstream issues that we've got to really occupy our minds with as at the same time that we're pushing for innovation. And I spend a lot of time thinking about this these days. In full disclosure, I'm a doctorate student. I'm finishing my doctorate. I was telling Nada and Liz, they know that, but I was telling them that I'm nearly finished. But my dissertation is on health policy, and particularly congressional policy, health equity, and artificial intelligence. And I'm telling you, Congress has a long way to go. And I want to say that irrespective of what happens next Tuesday, that we will still be having conversations about the electric energy in the air around women's health, around innovation. But we've got to be really clear to have conversations around those more upstream issues that don't always fall within the purview of industry.
Man, we could keep talking forever. We're at time, and I know we have a lot of questions that we haven't got to. So it seems like we need another session, more tailored, and we'll plan to do that if you'll give us more of your time. But I did want to ask each of you, maybe if you could take 15 seconds for your take-home message or your call to action or what you'd like to leave this group with. And I thank you in advance for your time. And so appreciative and grateful for you all. So, Jyoti, you unmuted. Go ahead.
I think Mia set it up very well, right? What happens next Tuesday? I think each of you have a role to play in what happens next Tuesday. And so really go out, cast that vote, and, vote for what matters to you. And if women's health matters for you, then do your research and vote accordingly. That would be my call for all of you.
Amanda?
Same, make your voice heard. You have a voice on Tuesday. Do your research, and we have an opportunity to continue to further focus on women's health, women's rights, and so please go use your voice and vote.
Thank you. Mia?
And Tuesday is really the final day. I'm going to right now go vote down the street because there are no lines, I don't think. I'm going to go and make that happen. And I also say to you what I say to the virtual audience, what I say to my 2-year-old son every day: do justly, love mercy, walk humbly. So I'll leave it at that.
Thank you. Mine is be kind, be curious, and be courageous.
I love it.
And that's why we need all of us together working to move the needle. So I thank you. I thank Liz and Bethany. Liz, thank you for all those amazing resources. And that's why Liz focuses on advocacy on the Hill. So thank you for your tireless work. You all have a blessed day. Happy Halloween. Be safe.
Happy Halloween. Thanks,
Bye.
everybody.
Thank you.
Thank you, everybody.
Happy Diwali. Bye.
Happy Diwali.